problem or musculoskeletal problem, and we like to see people that are just short of surgery. In other words, they've gotten some basic conservative care, the physical therapy or chiropractic, and when they're not better, they're not happy. I like to see these people, and there's a whole host of new treatments that are available to help them short of getting an operation, and that's what I specialize in. We take care of people that have disc problems in the spine, neck, back problems, sprains and strains. But one of the things we're going to be talking about today is an exciting new treatment to help take care of arthritis and tendinitis and other kind of muscle and tendon ligament problems.
There are problems too. Arthritis is so hard to manage.
Yes.
And everyone has it, that does have it, seems to have it either very strong or it comes and goes. And this seems to me to be a treatment, and from the people that we talked to yesterday, that really helped. So tell me a little bit about the treatment. It's called PRP.
Right, that's the initials for platelet-rich plasma matrix tissue grafting. It's a treatment where we're using the patient's own blood, and we're extracting the growth factors and stem cells and other undifferentiated cells which cause healing in the body out of the blood, and then we're transplanting them to the site of injury or arthritis to help get rid of their pain and actually heal the part, as opposed to just throwing cortisone at it or something else. You know, I've been in practice for 20 years, and you know, I started like everybody else with cortisone injections and just doing the standard things for arthritis. A lot of people out there might have heard about the rooster comb injections, where they're injecting Synvisc or Hyligan. You hear about that on television, and I did that for a while, and that helps, you know, some patients. But then I progressed, you know, as science progressed, I progressed along with it, and then we did the prolotherapy, which we'll probably talk about later. But now the next stage, and we're in not the 20th century now, we're in the 21st century, and it's really all about repair and regeneration. If you look on the internet in any area of medicine now, and you look at the pharmaceutical industry and what they're researching, they're all looking at how to fix and repair things, from the heart to the liver, to making new organs. And in orthopedics and musculoskeletal medicine, the state of the art now is to help fix arthritis, get rid of tendon injuries and things like that, and that's what this new treatment's all about.
Let's backtrack for a minute, though, to prolotherapy, because that actually came first.
Correct.
And you have patients who did have it, and maybe it didn't work as well on them as it did on others. And so you suggested this, which is like the next step up. The next step up,
right. Prolotherapy, also known as regeneration injection therapy, has been around pretty much for about 50 years.
What's the theory of that, you know, simply?
Very simply is the body has the capacity and ability to heal itself. If you cut yourself, if you break a bone, the body, you know, goes in there and it heals it. And what prolotherapy does is it acts like a magnet, such that you create a little inflammation, and it attracts the growth factors to come into the area by that inflammation and cause healing to occur. It works exactly the same as if someone went to a plastic surgeon, for example, and they had a laser peel or a chemical peel, and they burned their face with a laser, or they put, you know, a little chemical acid on their face. Not enough to hurt them, but just enough to make it red. And lo and behold, they get new collagen on their face, and the wrinkles go away and things like that. So we know in medicine that creating inflammation, a good inflammation, attracts the blood to the area, and thus the growth factors come along with it, and that's how prolotherapy works. So we've been able to help thousands of patients through the year, you know, with the prolotherapy. But there are some people with advanced arthritis and real tendon tears and capsular tears of the shoulder, we'll probably talk about later, that the prolotherapy fell short. So that's why I stepped it up with this new treatment, and been very satisfied with the results that we're getting.
There aren't many of you, though, in the country who do this procedure.
That's true.
How many?
Now there's probably closer to 20 or 30. When I started out doing this, I was one of 3 people in the country. I came upon this on my own. I was traveling in Europe, and the Europeans were using serum injections for cosmetic purposes to help build collagen in various parts, on the skin, for example. And I said, wow, maybe that would be good for, for the treatment of arthritis or something or other. Then when I came back to this country, I found out there was actually an FDA-approved machine that the orthopedic surgeons and the plastic surgeons were using to get this platelet-rich plasma that we're going to be talking about, and they would mix it with bone to make the bone heal faster. And that was exactly what I needed, and we started using that for repair of tendon problems and ligament problems and joint problems and things like that. And then as I researched it more, I found that there were a few of us around the country that were actually doing the same thing, and there were a few papers that were starting to come out on it. And we're going back now around 2001, 2002, and now the literature is just full of this kind of new stuff that's going on.
You are going to be presenting your work next month at the American College of Orthopedic Medicine.
Yes.
It's an honor, isn't it?
I'm very excited about that, yes.
What do you hope from that?
Well, I want to get the word out there. I think it's an important treatment because what I've seen is people that been told they need a total knee replacement or a total hip replacement, or maybe it was too early for them to go for one. They got the arthritis 10, 15 years too early. And I've been finding that we can get rid of their pain in 7 visits and get their function back, the way it was before they were crippled with the arthritis. And I'm hoping to get the word out so more people can do it around the country and help more people. So I think it's gonna change the way we treat musculotendinous problems and arthritic problems around the country.